It is helpful for providers to understand the unique background and experiences of many of their deaf patients. Every individual should have the right to communicate, express themselves, and understand the world around them. However, for deaf and hard of hearing individuals, access to language can be a daily struggle. Deaf children of hearing parents often experience language deprivation from early childhood. Language deprivation in deaf and hard of hearing children is a delay in language development that occurs when sufficient access to language, either spoken or signed, is not provided. This denies the child of the ability to develop language and communication skills in the first few years of their life, often called the critical or sensitive period. The impact of language deprivation can be severe, causing low self-esteem, difficulty in forming relationships, difficulty in school, and limited job opportunities in the future. Deaf people also experience lack of incidental learning. Incidental learning occurs when we learn information without even realizing it just by being exposed to it in our environment. Deaf patients with hearing parents may not have equal access to information informally discussed or overheard in the home because of lack of access to spoken English. This is sometimes referred to as the dinner table syndrome. This may include lack of knowledge of family health history, important to understanding their own health risks, lack of information about health information communicated through informal conversations, lack of access to public service announcements on the radio and TV, and information about public health current events like the COVID-19 pandemic. Due to this lack of access, studies have shown deaf people tend to have decreased health literacy compared to hearing populations.
Okay. I don't feel like I had equal access to information. I needed more information so that I could have the same information as my hearing counterparts. We're all human beings and we all need to be together. And we all need to have the same information instead of leaving people out, like I sometimes was left out.
Health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. All of these factors can lead to decreased health literacy in deaf populations. Deaf adults may have limited access to quality healthcare services, which can make it difficult for them to receive the care and information they need to maintain their health. For example, on-site interpreters are not usually available at vaccine clinics to answer questions about vaccine risk and benefit and combat misinformation. Lack of access to adequate communication services in healthcare settings can lead to misunderstandings, misdiagnosis, and a lack of trust in the healthcare system. Many health-related materials are not available in sign language or other accessible formats. Deaf patients may avoid seeking medical care or services. This phenomenon can be attributed to several factors, including communication barriers, negative past experiences, lack of access to information and resources, and cultural differences. Negative past experiences can also contribute to healthcare aversion in deaf populations. A bad experience with a healthcare provider who was unable to effectively communicate with them may cause reluctance to seek medical care in the future. These challenges can impact their ability to make informed decisions about their health and access appropriate medical care. Due to these factors, deaf persons experience many health disparities, including increased risk of cardiovascular disease, high blood pressure, diabetes, stroke, depression, and anxiety. As healthcare providers, educators, and organizations, we can work together to ensure that deaf adults have access to the information and support they need to maintain their health and well-being.